So many people ask me what type of treatment should I have for the hair loss that I'm experiencing. And there are so many different types of hair loss treatments, but really those don't matter unless we know what the hair loss diagnosis is. We have to understand what's the cause of your loss. In order to do that, we really need to evaluate you. We do that through a series of photographs as well as a series of questions that are geared to give me the information that I need. And you can come into the office for a physical evaluation, or you can do a virtual consult over the internet with us. But it's really important that we get this information because you could have male or female pattern hair loss, which is genetic, and there's various treatments for that that consist of both oral, topical, and surgical solutions, as well as something like alopecia areata, which is a totally different type of hair loss and with a different type of treatment. There's inflammatory conditions that cause hair loss, and those again have a totally separate treatment regimen. There's also temporary forms of hair loss or shedding, telogen effluvium, things that we can shift medications or nutrients that you're taking, and such as thyroid or problems with anemia that can alter the way your hair is in its appearance and the loss as well. So there are many different causes for hair loss and a multitude of treatments, and we offer virtually all the non-surgical and surgical treatments that are available. But what's important is that we have early intervention and that we have the proper diagnosis so that we match the treatment that works best for you.